Everyone, and thank you for joining us today for an important conversation with Heather Booth from the Biden-Harris campaign and Kristin Urquiza from Marked by COVID. We must start today by acknowledging the devastating loss of Justice Ruth Bader Ginsburg, a champion for justice who spent her career fighting for equal rights for all people. She won many breakthroughs for women in her fight for gender equality and held an unwavering faith in the power of American democracy. While we mourn her loss and celebrate her life, we must also come together to fight for the future of that very democracy. With just 45 days to the election, the current administration's focus has already turned to naming a replacement to Ginsburg's vacant seat on the Supreme Court. The Senate Republican support for a confirmation of a Trump nominee is nothing short of a hypocritical, self-serving political ploy to benefit the party's agenda. If we do our jobs right, Trump and those who support him will be swept out of office by January. We can't allow them to cling to power by stealing a second Supreme Court seat. The American people should have a say in the selection of their next Supreme Court justice. The appointment of a third Trump justice will affect American politics for decades to come, as conservatives would gain overwhelming control of the third branch of the federal government. The call to action to elect a new president who will be responsible for nominating a new justice has never been more imperative. We cannot stand by and watch. We must come together and fight like hell for a future that honors Justice Ginsburg's work and her memory. We must build the equitable world that Ginsburg fought for and add to her legacy. And that means fighting for a bold response to this pandemic. While Trump and his supporters use the Supreme Court nomination process to distract from the COVID outbreak, we must stay focused on addressing the multiple catastrophes our country is experiencing. The COVID-19 death toll is fast approaching 200,000 in the US. On top of this horrific loss of life, millions are out of work, unable to access life-saving healthcare, and are trapped in cycles of poverty. Some are on the brink of losing their homes from bankruptcy and the climate disasters happening all over the country. This pandemic is devastating poor and marginalized people in the US and across the globe, and disproportionately affecting communities of color. Donald Trump's deadly, irresponsible, and turns out deliberate bungling of the US response is an unacceptable travesty. We must hold him and his party of enablers accountable, vote them out of office, and leverage the fissures of this moment into transformative changes for an equitable world. We know that this pandemic is not an isolated disaster. It's part of an accelerating wave of pandemics. Corporate globalization and climate change are bringing more and more pandemics, and they'll continue to come faster and faster. The next pandemic is inevitable, and we need to be prepared. It could be more contagious or more deadly, or both. What we do know for sure is that more people will die. But it doesn't have to be this way. Pandemics, poverty, and climate catastrophes are the products of unjust and highly problematic policies. We can't stop the problem by focusing on the US alone, or only by opposing Donald Trump. We also can't do it without tackling the policies of inequity and exploitation that got us in this mess in the first place. The COVID-19 crisis presents us with a historic opportunity to come together and create a more equitable and just reality for all of our futures. We at Right to Health Action are a grassroots movement of tens of thousands of experts, health workers, and activists in all 50 states. Sparked by the pandemic, our goal is to take action to repeal and replace the deadly policies that cause cycles of pandemics that disproportionately impact the already poor and sick. We're fighting for political change to ensure that the human right to health is realized by everyone, everywhere. We can't stop a pandemic anywhere until we've stopped it everywhere. In the face of unprecedented challenges, our current president has completely failed to step up and lead. His administration and our current Congress's inaction has led to the unnecessary deaths of hundreds of thousands of Americans, with no end in sight. We're organizing a wave of meetings over the next 4 weeks with more than 300 members of Congress to ask them to support stronger pandemic response policies, and as of yesterday, to oppose a Trump nominee for the Supreme Court. As Ruth Bader Ginsburg once said, "Fight for the things that you care about, but do it in a way that will lead others to join you." Join us as we join forces with the Biden-Harris campaign and fight for our right to a political voice, basic equality, and health. I'd like to start by introducing Dr. Hannah Lixson, who will serve as the moderator for today's conversation. Hannah is an internist and pediatrician in Minneapolis, working on the front lines of the pandemic. She also serves as the assistant professor of medicine at the University of Minnesota, specializing in sickle cell anemia. She's a co-founder of the Minnesota Immigrant Health Alliance, co-chair of the healthcare advocacy organization Our Stories, Our Health, and board member and policy co-chair of the Minnesota chapter of the American Academy of Pediatrics. She's also a Leaders in Health Policy Fellow with the Society of General Internal Medicine. Welcome, Hannah.
Akshita, thank you so much for that introduction to our work. And thank you everyone for joining us here today. Like you, I'm grieving today for Justice Ginsburg. I owe her so much, likely more than I know. And now after her death, the responsibility falls on all of us to take on the mantle of her fight. We all come to the work of advocacy for different reasons. I am here for my patients. As a primary care doctor, there's only so much I can do within the confines of my clinic. Yes, I can recommend vaccines, tests, and medications, but tragically, that's often too little, too late. The hands-on care I can provide isn't enough to keep my patients healthy because of policies causing them harm on a global scale. Just this week, I cared for someone who had lost 2 family members to COVID and then was harassed for wearing a mask when he went to a hardware store. Another of my patients is terrified not only that she won't be able to afford a vaccine when it's available, but that if she does get sick, she won't be able to afford any treatment. And then just yesterday, I found out that one of my patients was admitted to the hospital because the medicine, the life-saving medicine that she depends on, had been delayed at the post office because of Donald Trump's policies. This pandemic affects the health of everyone I care for, some directly through severe illness and some indirectly by impacting their capacity to work, access food, housing, and education for their families. Like in the examples I just gave, the policies we talk about today are not abstract. On the contrary, the results of our November election and adoption of a pandemic prevention platform are a matter of life and death for many. With the bold leadership of Joe Biden and Kamala Harris, we will have the capacity working together to end this cycle of pandemics. To talk about just how we're going to do that, I'm humbled to introduce you to 2 amazing progressive leaders fighting for our democracy. First, joining us today from the Biden-Harris campaign is Heather Booth. Heather Booth is a leader among activists and a current advisor on the Biden campaign. She has been an organizer since the civil rights, anti-Vietnam War, and women's movement of the 1960s. She was the founding director and is now president of the Midwest Academy, training social change leaders and organizers, including some of Right to Health Action's own leaders. She has led campaigns with the NAACP, AFL-CIO, Americans for Financial Reform, and the Coalition for Marriage Equality, among others. We are so grateful to have her with us today. Welcome. Heather, I'd like to start by inviting you to share with us the steps that the Biden-Harris campaign is taking to prevent pandemics and build back better.
I thank you so much. And I thank all of those who are watching. Hannah, you've been such an important healthcare provider and provide care both as a physician and provider, and also as a social change provider, so that it's both on a personal level, on a social level, and on a systemic level. And you understand that the change needs to be systemic. I want to thank others. I'm so glad to be on this panel with Kristin and look forward to what she's saying. I was so moved, as was so much of the country, and touched, as you touched our consciences with the story about your father's unnecessary death, so young, because of this president who cared more about his own political fortune than the lives of the rest of us as we approach 200,000 deaths. And at a time we mourn the deaths of so many, we commit to carry on this fight. I particularly, by the way, for this audience, want to thank Paul Davis, who's an organizer's organizer, who's among the people who've changed the terms of AIDS treatment, prescription drug coverage, and showed us that you can take on some of the biggest corporations in the world and win if we organize. And for us, sometimes the moments of greatest challenge, and I start with that because we are in one of the moments of greatest challenge, certainly that I've ever faced in my life. Sometimes those moments of greatest challenge can be the moments of greatest promise and change, but only if we organize and if we seize the moment. This is a history-breaking moment, a history-making moment. We all need to be a history-making people. We do remember Ruth Bader Ginsburg, who brought such promise, not only with her work on marriage equality and on women's rights, but also sustaining affordable care and workers' rights, and reflecting the organizing that was going on that allowed a court to move us forward. And it's also a time of such incredible peril because we face an option where there will be a pushback on just about everything we fought for the last 50 years or more. Letting people die from COVID, high prescription drug costs, children being ripped from their parents' arms and put into cages, on climate, on women's rights, on civil rights, and on democracy itself. From my own background, I began my work in the civil rights movement. In 1964, I was in Mississippi Summer in the Freedom Summer Project, and that many of you have heard about because it was the summer when 3 young volunteers, Andrew Goodman, James Chaney, and Michael Schwerner, were killed at the hands of the Klan. What you may not know is that while they were looking for the bodies of those 3 young men, they found the bodies of 8 other Black men whose hands were bound or feet chopped off. And those deaths hadn't even been investigated at the time until years later as cold cases. I mention it because in a time of such peril, when things seemed so hopeless, in fact, there was a chance to really make progress. And within a year, there was a Voting Rights Act, but because people organized. And so that's the moment that we're at today. I thank Right to Health Action, who brought us together today, and this impressive group of organizers, healthcare workers, and families. I'm here really to say that the deadly cost of the Trump non-plan to divert, distract, and mislead is so contrary to the Biden-Harris campaign, which is committed, as you are, to transformative COVID-19 plan to stop pandemics now and in the future. You asked about Vice President Biden's plan. On March 12th of this year, the Vice President released an expansive visionary plan. He included in his plan an enormous level of detail and specificity, all of it on his website. He's bringing into seriousness and depth of someone who knows about how government works and has a plan to mobilize the whole government, in fact, the whole planet, in response to and to reverse this deadly disaster foisted on us, made worse by Donald Trump. Joe Biden's plan to stop pandemics responds to science and our values. Much of this progressive, ambitious plan can be found at joebiden.com and is spread across his COVID-19 plan, his healthcare plan, Build Back Better plans, not just to go back, but to build back better, the climate plan, as well as public statements and posts on Medium and in other places in the press. I'm not in the policy department and so won't be going too far into the weeds on technical questions, but I can share some of the highlights of the plan. Number 1, we're going to restore and increase global health and pandemic prevention funds cut by Trump, rebuild the global health security agenda, rejoin WHO, and create global and domestic coordination bodies driven by science, cooperation, and compassion. Number 2, we'll get a handle on pandemic price gouging during and beyond the pandemic for all the medicines and vaccines our tax dollars are paying to invent. We're going to pass the boldest plan to control drug prices that we've ever had. And Joe Biden also said to our hero, Addie Barkan, that drug company monopolies won't be a barrier to global access for vaccines invented in the United States. Under a Biden administration, low-income countries will have access to the medicines needed to stop pandemics, and America will finally rejoin the world community to collaborate with programs. Just as they did with the Obama-Biden administration, was the first to contribute to this medicines patent pool. Donald Trump's nationalistic rejection of international cooperation could put Americans last in line. And according to Dr. Ami Bera, Democratic congressperson from California, who said, quote, "Joining COVAX is a simple measure to guarantee US access to a vaccine, no matter who develops it first. The go-it-alone approach leaves America at risk of not getting a vaccine." Number 3, we're going to dedicate hundreds of billions of dollars to build a new green economy, including hitting at deforestation and climate change, thereby halting the largest source of rapidly spreading new pandemics. 4, we have a bold vision to rebuild the economy, not just to where it was, but to build back better, transformative change, living wages, rebuild industry, investments in public health, making the repairs and restitution we need to undo the damage wrought by Donald Trump, and more. It's not him alone. Accessible, rapid tests for everyone, support and caregivers for veterans, the homebound, the quarantined, and our seniors in and out of nursing homes, fighting opioids and substance use disorder. Number 5, we'll launch a 100,000 person public health corps. And we start with global health. What Right to Health says is true. We cannot stop a pandemic anywhere unless we've stopped it everywhere. Joe Biden knows that. And so that's part of the plan of what he's going to do.
Thank you so much for sharing with us, Heather, about what the Biden-Harris plan kind of dives into with regard to preventing pandemics and getting us through this one. I love what you said, and I know it comes from Right to Health, but it's so true that we can't end this pandemic anywhere until we end it everywhere. What happens in every corner of the world affects the health of the patients I care for here in Minnesota and people in every other corner of the world, because viruses don't respect borders. They don't care where we live, they affect us all. I think we'll have some time to talk more about the components of this pandemic prevention plan, and I encourage everyone listening to look to the details and look to the Biden campaign, as you suggested, to see what he's proposing. It is very detailed, and it's unreasonable for us to go into great detail on each of those things with the limited amount of time we have today. But thank you for that overview. Next up, I'd like to introduce everyone to just an amazing person, Kristin Urquiza. Kristin grew up in the Maryvale community of Phoenix. She's a proud product of public primary education and the first person in her family to go to college at Yale. Her grandparents were migrant farm workers from Mexico and Oklahoma, and her father worked in the fields as a child. She was an organizer against climate change when in June her parents contracted COVID-19. They became ill because Donald Trump and Arizona Governor Doug Ducey downplayed the severity of the coronavirus. Her dad, a previously healthy man, died on June 30th. With the help of family and friends, she wrote the first honest obituary, invited the governor to her dad's funeral, and held a vigil at the state capitol. She launched Marked by COVID to honor her father and was invited by Joe Biden to address the Democratic National Convention, where I can say personally, she gave one of the most powerful speeches of the week. With Marked by COVID, Kristin elevates the stories of people who have been impacted by COVID-19 in order to enact bold changes in policy. Through their negligence and malice, policymakers in the US, including but not limited to President Trump, have contributed to the deaths of nearly 1 million people worldwide, perhaps more, and she is working to hold them accountable. Kristin and her team are organizing to inspire and win systemic policy changes that we need to transform our world beyond COVID-19 so that this nightmare never happens again. Welcome, Kristin, and thank you so much for joining us today. Can you tell us a little bit more about your story and your work to fight for justice during this pandemic?
Yes, absolutely. And thank you so much for having me here. Right to Health, it's been great working with you over the course of the last several weeks towards this. And then Heather, it's wonderful to meet you and Hannah as well. And just wanted to say welcome to the over 500 participants that we have on this call right now. I think it's incredibly inspiring to me to see so many people interested in hearing what we have to say about this incredibly important time, and also to hear a little bit more about my story as well. As Hannah mentioned, I before this summer had been an organizer working in the space of environmental protection. Interestingly enough, my background is working to stop deforestation, especially from tropical rainforests, which, as Heather mentioned a moment ago, is one of the best antiviruses for future pandemics. So when the pandemic started to reach the United States, I was already very much aware from both an environmental perspective, but also a public health perspective, that this was going to be a crisis. Also, growing up in such an humble neighborhood, full of culture and wonderful people, but not typically invested by the government, I knew right away that the pandemic, if mishandled, would disproportionately impact my community and the people that I grew up with, and potentially even my parents. So I took it upon myself to talk to my folks every single day from February until my dad got sick, about our mitigation plan as a family to ensure that they would stay healthy. My mom has she's diabetic and other underlying health conditions. So both my dad and I were really worried about her health, especially given in February and March, the information kind of provided to us really kind of highlighted this information that we now know is not true, that this only affects people with underlying health conditions. We do know now that it affects everyone in a myriad of different ways. I share this information with you all because I represent somebody who has had an incredible amount of information, both through my education, but then also my work and experience to know, to be able to educate my loved ones, and yet I still was not able to keep them safe. And that is really what we're here to talk about. And what I've been doing since my dad passed with Marked by COVID is that it is incredibly important that the people in charge do their fundamental job, which is to keep us safe. This president has not just abdicated that responsibility, he has looked it straight in the face and said, I do not care about the American people. I do not care about people like Kristin's dad. And I do not care anything about this pandemic. I only care about my own self-interest, my own political prospects, as well as the stock market. That's why he said he didn't want things to panic. He didn't want people to panic. People don't panic. Stock markets panic. And my dad didn't panic. My dad died. When the state of Arizona reopened on May 15th, the governor of Arizona, Doug Ducey, went on a media spree to impress upon his constituents that it was safe. If you did not have an underlying health condition, it was safe to go back to normal activities, to go shopping, to go hang out with people, to get back to normal. My dad was a supporter of Doug Ducey. My dad was a supporter of the president. Mind you, we hardly agreed on anything politically, but my dad did what we are supposed to do during times of crisis. We are taught and we have studied that during times of crisis, you follow the direction of people in charge. That is what my dad did, and it cost him his life. Within a couple of weeks, my dad got sick. Of the reopening, my dad got sick and then passed away 19 days later. Having a loved one contract COVID and get sick from COVID is the most agonizing and painful thing. You're not allowed to be with them. It's hard to get updated information from their healthcare providers because the hospital systems were so overwhelmed at that time. I remember thinking on a daily basis, this should not be happening. And also thinking, this is what agony feels like, and I would not wish it upon my worst enemy. So when my dad died, I knew that I needed to speak up and to lean into my organizing skills and background and expertise to call a spade a spade. My dad died because of COVID-19, but my dad also died because of the failed policy decisions of the Trump administration and his henchmen like Doug Ducey and their terrible leadership through the most important public health crisis in 100 years. Since then, I've been working with other families who have been marked or impacted by COVID to help them uplift their stories and call out their elected officials for failing them on the pandemic response through my organization, Marked by COVID. And then obviously, I've been very vocal both in the media, through the DNC, and other outlets to help share my story and others to really draw a huge spotlight on the colossal failure of the Trump administration. The final thing I'll say is on that note, there is no way we are going to be able to get through this pandemic alive with the leadership of Donald Trump. And I think it's really important for us in the coming several weeks between now and November 3rd to come together on this single goal. And while we need to, on November 4th, when we elect Joe Biden, continue to pressure the Biden-Harris administration to do everything that we want them to do. In the interim, we need to make sure that they're there in office because Donald Trump will not do anything for normal Americans like my dad. So I'll just pause there and say thank you again so much for allowing me to be here with you all and build upon my story. And I look forward to the discussion.
Thank you. Seriously, thank you for sharing your story. I know you've been sharing it a lot, and I can only imagine how hard it is to relive this. And I know I'm seeing a lot in the chat from people who are sending their love your way, but thank you. As you have shown in everything you're doing, people's stories are powerful. They're incredibly powerful. And by coming together and sharing our stories, we can enact some real lasting change. I'd like now to have a conversation. I know that a lot of folks submitted questions early on during registration, and we were happily overwhelmed with them all. We've given a list of every question submitted to both of our panelists. But given the tragic loss of Justice Ginsburg and the upcoming fight for the Supreme Court, I'd like to change gears now. And instead of talking about the details of our policy asks and the ways we're pushing for more and better constantly, I want to talk about the steps that we can take now and the things that we need to do together to fight for our democracy. So I want to start, Heather, by asking you, so every day that passes, this election just seems more and more important. You've talked about the Biden-Harris campaign's approach to pandemic prevention. We also know that a real fight for the Supreme Court is on the line. How do these issues frame your approach to getting people to the polls and electing Joe Biden as our next president?
Well, the Biden campaign is working with the coordinated campaigns in the states. And if you want to get rid of Donald Trump, you need to elect Joe Biden and Kamala Harris. It's a time to tell Trump he's fired and you hire someone else. And the strength of any new administration will reflect the strength of the organizing that all of you do, that you've done so far and that you will be doing in the future. And the coordinated campaign drives forward the campaigns of Democrats at every level. So president and vice president, Senate, House, but also state and local levels, which are also important, and the control of state legislatures and the controls of secretaries of state. Sometimes it's not just who votes, but who counts the vote. District attorneys having to do with criminal justice reform and other things. So that all of this is part of one unified campaign effort. There are 17 states that are treated as the battleground states in which the election is likely to be decided. There are other states in which it is an overwhelming likelihood that it will either go Democratic or Republican. And so there still may be important races inside of those states. But for the Biden-Harris campaign, we have particular staff in 17 states. There are over 2,500 staff now in those states, and more will be even hired as we get closer to the election. The 17 states, by the way, are Arizona, Florida, Michigan, North Carolina, Pennsylvania, and Wisconsin. And I'd say those are top tier states. And then there's Nevada, Colorado, Texas, Minnesota, Iowa, Ohio, Maine, New Hampshire, Georgia, Virginia, and the 2nd District in Nebraska. Within many of those states, there are key Senate races, certainly in Colorado and Maine. There also are other key states with key Senate races, South Carolina and other places. And we are glad that people will be joining in and focusing on the races that have their that will have their greatest focus right now. And there is this overall coordinated effort. What I would say on the coordinated effort, right now in this COVID socially distanced environment, which is so strange for almost everything we do, there are 2 prime things we need people who are watching this and listening to this to do. A prime thing is to join our phone banks and text banks and be volunteers, talk to those people in those states, make the phone calls. You can text progress to 30330. Text progress to 30330. And that's one way to volunteer. You also can get our daily updates if you're interested in those. If you go to joebiden.com/coalitions, there's then a button that says join, and you go to progressives and you'll get our daily updates. The other thing is to amplify the messages. The messages regularly from the campaign, and on social media, we hope that you'll be spreading the word. There are others. I saw a note that said some people wanted to know to answer the question about the Senate races specifically. There may be someone else who can address that. I'm not trying to avoid the question. It's just that I'm most familiar with what we're doing with the Biden-Harris campaign and our supportive relationship as part of the coordinated. And glad to say more things about how the campaign itself is organized, but I think that's it for now.
I may come back to you on that, but let's move on to a slightly different question. Kristin, the Trump administration, among other things, has undermined the integrity of our scientific institutions like the CDC and the FDA by politically influencing guidelines and promising a vaccine on a really short timeline when the data hasn't yet shown that one will be safe and effective. What can people do to ensure that a vaccine is properly studied and vetted before it's released to the public?
Thanks for asking, Hannah. This is definitely something that I have a lot of worry about and keeps me up at night. It also reminds me a lot of my own story, in which the very few people who lash out at me do talk about how I've politicized my dad's death. My response to that is I'm telling the truth. My dad, this is what happened to my dad, and the president is the one who politicized his death by politicizing simple public health measures. And building from that, we need to call a spade once again. The Trump administration is working to continue to politicize and undermine public health. And I think that in the weeks leading up to the election, we very much have to be terrified about a rushed vaccine that will jeopardize our entire scientific process to ensure we have something that's safe and that's something that can be distributed. And also from a just historical perspective and thinking about equity and who continues to be tested on and sort of these hocus pocus snake oils, it tends to be people of color. We cannot be putting out a vaccine that we are then distributing to the folks who have been most impacted and using them as guinea pigs in testing to ensure its efficacy. So for what people can do, I know that Right to Health is organizing around this particular issue. There will be a huge national day of action on October 15th, which I invite everyone to participate in. And there's also lobby days happening. Every single person on this call who is committed to this work needs to contact your elected official to tell them exactly how you feel and to tell them that a vaccine cannot be rushed to market. Thank you.
By the way, the Biden campaign and Vice President Biden has spoken to this repeatedly, that safety and science have to guide us first. And that's true for the public policy. It's also the policy in the campaign. It's why the campaign itself isn't doing the door-to-door canvassing, even though some other organizations are. But it's why we've started functioning much more in this virtual world. There will be some in-person activities, by the way, in the campaign as we get closer to the election. I saw one question in the chat box about leaving flyers at the door. There will be, and people will be recruited to volunteer corps to leave flyers at doors with a personal note. If we miss people, if we find people, we can talk with them there. If we miss people, we'll then follow up with a phone call. And probably in the next week or so, we may have information that we can send around for people who would like to do that kind of in-person work. There also will be tabling, particularly on campuses. A very extensive campus network's been established, HBCU network, and some other opportunities, but most of the work is this phone banking. There's a great deal of texting going on, but the phone banking is really what is the priority, or using the Vote Joe app. And someone mentioned also the relational organizing, where you contact, it's vote tripling, where you contact 3 of your friends, your family, and people who you know, particularly those who may be less likely to vote or less informed about even technically how you vote in a pandemic, which we know is an issue, particularly for young people.
Thank you. Thank you both for speaking to that. You know, as you mentioned, Kristin, with Right to Health, we are organizing on this issue, and we're working with Senator Warren and Representative Ro Khanna to make sure that the people's vaccine is free to everyone, everywhere, instead of the public's research being held back by a private patent monopoly. Those are barriers that leave out millions of Black and Brown people and people living in impoverished countries. We all need access to this vaccine, and it needs to be a vaccine that's based on science and data rather than political motivations. I have a question here that came in on the chat. It's from Jean Schaap. I hope I'm pronouncing that correctly. She said, I'm phone banking in Arizona. Are there any keywords, hooks to change minds at all? We're also frustrated when people don't listen. And so I'm curious from perhaps both of you on what strategies you have used, whether it's from telling your stories, sharing information, what do you recommend we use for influencing and changing minds?
By the way, there just was a study done, polling done by John Della Volpe, who's now a pollster in the Biden-Harris campaign, who had been the lead pollster for, ran the polling institute at the Harvard Kennedy School Institute of Politics for, I think, about 20 years. He's just come over to the campaign. And I can send it to you, Hannah, or Paul, and others to send around. It's a few-page summary of this polling on how you talk, especially to young voters. Many progressive voters are young voters. Many of the changes of trying to engage people in the Latino community, in the African-American community, are young voters. One element is people are not sure about how to vote. I don't just mean who to vote for, because we're actually pretty sure that if they vote, they'll be voting in a progressive direction and for Biden-Harris, but they're not sure literally. I was just on a briefing, many saying they didn't know, they've never put a stamp on an envelope to send a letter. How would you vote by mail? What is a drop box, if that's what you do for voting? Do you vote at home, or do you vote in person? Yesterday, there were 2-hour lines in Virginia. What do you do? So one element, it's not the whole thing, but one element is an important educational element about how to vote. There's a website, iwillvote.com, that lists the voting rules and regulations by state, with the locations of drop boxes, the location of polling places, and the rules vary so much by state. In Florida, we're finding people are more and more interested in voting by mail. And actually our phone banks there are connecting people while on the phone to the local supervisor of election, it's called, and getting them registered to vote by mail. In North Carolina, it's much more difficult to vote by mail. And so there's a bigger push on voting in person. But the keys, and these are on the messages on this area. One is vote early. Whichever form you take, vote early. And secondly, make a plan. And if you have a plan, and here are the 3 magic words, it is easy, convenient, and flexible. Now, I used to say that it was safe and secure, and now part of the polling told us, you say that it's safe and secure, and people say, is it safe or secure? So that whoever asked the question, the messaging really does matter. So that's one thing just about public education on what's involved in voting. A second thing is, particularly for young voters, there's a question about who is Joe Biden. Many people, young people, don't know his story. They don't know that his wife and child were killed in a tragic accident, and that he came home from Congress every night in order to be with his kids. There's a story of, just as you're saying, Hannah, this, and that Kristin says, a compassionate story, and telling those stories, as well as sharing what's really in his plan. And these elements of the plan that I've described are such progressive elements, many people don't know about them. There are also then some people for whom he may not have been their first choice. I was originally a Warren supporter. And then realizing that, as Bernie Sanders said, if we elect Joe Biden, we may enter into the most progressive era in modern American history, and the most progressive era with the boldest program since FDR. So it's getting, it's providing education about voting, education about the candidate and the progressive policies, and then also including validators who've made an assessment. And I just saw something from AOC last night, I don't know if it was YouTube or on Facebook, but it was a powerful statement saying that Biden-Harris really is a pathway to providing for the progressive future we want to see, as long as we also continue to organize. So those might be some ways to approach it.
Thank you. Kristin?
I'm happy to just add on a couple of things. Heather, your response was so beautiful. And really one of the things I was thinking about was the need to ensure that people have a plan to get out and vote because it's so easy to get sidetracked or stuck in some small little logistical detail that can discourage a loved one or a friend from voting. Going back to the very specific question of what do we do if, folks that I'm talking to on the phone, I've done, I don't know, more hours of phone banking in my life than I could even count. One of the things I love so much about phone banking is that really what you're trying to do overall is find the people that are, agree with you or most likely going to agree with you. There's going to be some people that just do not, for whatever reason, are ever going to vote for Joe Biden. And those people you want to spend as little time with as possible. And so part of what I really dig into whenever I am phone banking, and I just give you the secret tip, is that I always pretend that I am calling my best friend on the other side of the line, and that I am just haven't spoken to them in a really long time. And so my greeting is just with that sort of focus in mind, in which I'm really trying to make a personal connection with the person who answers the phone. That way we can just have a conversation, and then I can figure out whether or not they're likely to be a supporter or not. And so I just really give you that tip that as you're phone banking, which everyone should be doing, just think about it as your best friend on the other end of the line, and it will help enable you to have a conversation with that other person as a person to person, which I think is really important right now.
Thank you. And it's we're all individuals, we're all people, and it's really by recognizing the value of our individual stories that we share so many similar values, and engaging with people on that individual level can have such an impact. So thank you both. Heather, you mentioned in your opening that this is one of, if not the hardest times you've lived through. I want to hear what's giving you hope.
In part, you all give me hope, and your numbers magnified. You've helped bring about this promising period that we're in, and I view it as a period filled with promise. And it's often filled with promise by young people taking the lead. I'll be 75 shortly after this election. I actually, by the way, had sworn I would never be in a campaign again. Never, never, never. In fact, I told my friends, stop me if I ever decide. And it really is the young people who need to take this on. I started when I was young. I was probably about 13 when I was first active in the civil rights movement, and then the women's movement, and then the movement against the war in Vietnam, and then union organizing, and for marriage equality and climate, and for many other things going on through to today. But I joined this campaign against perhaps my better judgment because I could see how everything we cared about was being rolled back, how lives were being threatened, how literally people would die unless we took action. And when I looked around, I also did see so many signs of hope. The fight for 15, Black Lives Matter, the beauty of people in the streets coming out in DC. They'll be out at the Supreme Court tonight around recognizing Ruth Bader Ginsburg, Demand Justice, and other groups in the fight for democracy and equality and justice. And many of those movements are led by young people of color and by women. One fact, by the way, about the Biden campaign, it's one of the most integrated large-scale operations I've ever been part of, racially, by gender, by the majority of staff are people of color. The majority of staff are women. That's true for the majority of leadership also. And there's a caring culture in the campaign, which is certainly not true in many campaigns. It's intense, but it's very caring. We end meetings often with gratitudes to each other. I mention it because all of that reflects a caring community that reflects both Joe Biden and Kamala Harris's leadership. But it also reflects something that's new about this era. And so I find hope in this period, while I also think that there is a great deal of peril. And I'm reminded of a great quote from that we need to have hope and optimism of the intellect, pessimism of the intellect and optimism of the will. Pessimism of the intellect to say, I see all these bad things that are happening. I realize what we need to do to make a change. But optimism of the will. And together, if we organize, we can make that change.
Thank you for that. I like that. Kristin, what's giving you hope?
I will have to say that over the last couple of months, I have met so many people who have had similar experiences to me, who have gone through the most ultimate loss and are experiencing unimaginable grief, having lost a loved one to COVID. And these are folks that are organizing right now to share their stories and hold Donald Trump and others accountable in their darkest moments, in their darkest times. And many of them for the first time, speaking publicly, picking up the phone, writing letters, engaging their family members and extended communities and why it's so important to vote this election cycle and what it means to them. Seeing these individuals lead in their grief and turning that pain into purpose is one of the most beautiful and awe-inspiring privileges that I've been able to have in my life. And so that is giving me just an entire waterfall of hope these days.
Thank you both for sharing that. I think we need to come into this fight with optimism of the heart. So thanks for sharing the many ways that we can join this fight, not only to end the pandemic, but to restore democracy to our country. I so appreciate your stories and your expertise in helping us build a strong coalition. Now, I'd like to invite everyone here. I've seen a lot of people asking how to get involved. I live in a blue state. How do I advocate? How do I start? So I want you to join us not only in electing Joe Biden, but also in taking our demands to Congress. Already, more than 75,000 people and 250 organizations have signed on to the People's Pandemic Prevention Plan. Over the course of the next 20 days, volunteers and activists with Right to Health Action will be meeting with over 300 members of Congress in support of our pandemic prevention plan. This week, Senators Elizabeth Warren and Barbara Lee, along with Representative Ro Khanna, have signed a letter in support of our plan, and we're meeting with representatives in all 50 states to get widespread endorsement. In light of our new fight for the Supreme Court, we're also going to be, as part of those calls, demanding our congressional leaders to commit not to confirm a new Supreme Court justice until after Inauguration Day 2021. This is a lot of work, but together we're up to the task. So we're excited to have you join us in this fight. If you're new to Right to Health Action, please go to our website and sign up, and we will be in touch with you about joining our campaign. Thank you again, everyone, especially to our panelists, so much for joining us today. You're all an inspiration. Please keep fighting, keep building this movement, and keep telling your stories, because together we are powerful. I look forward to organizing alongside you as we fight for our futures. Thank you. And I think We'll leave the chat for a moment here, but that is the end of our time.
Thank you, Heather. Thank you, Kristin. Y'all are so amazing.
Thank you so much for having me.
Yeah, we'll send